Hi guys, welcome back to our channel. Last week we talked about the concepts, classification, symptoms and risk factors of diabetes. Today we're going to be talking about the diagnosis, prevention, complications and control of this disease. Okay, when we talk about diagnosis, there are three principal ways we can diagnose diabetes, right? The first one is what we call the random glucose test. The second one is the fasting glucose test, and the third one is the oral glucose tolerance test, right? So what is the random glucose test? When a person has symptoms like the ones we discussed last week, you're peeing too much, you're drinking too much water, etc., and they take your blood sugar without you having to go through any previous fasting time, and this value is 200 milligrams per deciliter and above, that is one criteria for the diagnosis of diabetes. The second one is the fasting glucose test. In this test, you have to fast at least 8 hours, right? At least 8 hours of fasting time for you to be able to take this glucose test. Most times your doctor tells you to come very early in the morning and for you to have your last meal the day before, more or less between 6 p.m. to 8 and 7 p.m. so that you can have at least 8 hours fasting period. Then you come for this test. When the value of this test is 126 milligrams per deciliter and above, that is a positive sign that the patient has diabetes. Now, when we do this random glucose test and the fasting glucose test and the results come out inconclusive, then we proceed to do the oral glucose tolerance test, where the patient also has to go through 8 hours to 16 hours fasting period, which is not less than 8 hours and not more than 16 hours fasting period before you can take this test. And then the doctors, they give you a glucose of 75 grams so that they can see how your body reacts to this glucose. So after 2 hours of giving you this 75 grams of glucose and the values turn out to be more than 200 milligrams per deciliter, then that's also a positive criteria for diagnosing diabetes. So there is another criteria that they use to check the comportment of your blood glucose for at least 3 months, and this is the glycated hemoglobin. So when this value is 6.5% or more, this can also be used as a criteria for diagnosing diabetes.
Next will be treatment. How do we treat a patient who is diabetic or has been diagnosed with diabetes? Number one, the first thing we have to do is realize that this patient needs to be educated. We need to educate this patient about their disease. One of the things we need to educate them about is their diet. They have to realize that their diet will change. They will no longer eat what they used to eat. We have to educate them on exercise, the need for them to do exercises and what kind of exercises they should be doing. We have to also educate them on the types of medication they will be taking depending on what type of diabetes they've been diagnosed with and how to administer this medication, especially in the case of insulin. We also have to teach these people or these patients what kind of things they have to avoid, what kind of habits they have to avoid, like smoking and drinking. And most importantly, we need to teach or educate these patients about taking care of their feet, because the feet is one of the parts of the body that diabetes attacks and leads to amputation. So we need to educate this patient on how to take care of their feet, do annual checkup on their feet, make sure they wear the right type of shoes, and any kind of symptom or any kind of injury they have on their feet, they need to make sure that they report to their doctor. We also have to teach this patient how to identify signs of hypoglycemia, which is the opposite of diabetes, because diabetes is high glucose level. Sometimes this patient can suffer from low glucose level, and so we need to educate the patient on what kind of symptoms they will see: sweating, they begin to tremble, and various kinds of symptoms, weakness, and double vision and all that. So they need to be able to identify when they are having hypoglycemia, so they can realize that probably they need to take something sweet at that moment if they have, or they need to be rushed to the doctor. We also have to educate the patient on how to identify the symptoms of alarm. Okay, for example, when the symptoms which you have mentioned in our last video becomes excessive, when you start vomiting, you start having abdominal pain, you start becoming pale, these are signs of alarm and you need to be rushed to the hospital. Okay, now as we don't finish the talk about education, we want to talk about the main treatment. First of all, we want to start with diet. First of all, person get diabetes, now to start diet and exercise first. If e no work, then we fit come advance go dey use other medicine. So for diet, person wey get diabetes suppose to dey chop 6 times a day, 3 main food and the other ones na small snack in between the main food. Then suppose know how to balance their carbohydrate and their protein and their fat level inside this food. Dem fit eat 6 times a day, but no be large quantity. They suppose to dey chop small quantity of food. And generally we get this idea say person wey get diabetes no suppose to dey chop carbohydrate, say na the carbohydrate dey increase in sugar level, but no be so. Actually, for the food when the person dey chop, im suppose get 50 to 60% of carbohydrate, but no be the quantity, no be the carbohydrate itself na im we dey look, na the type of carbohydrate. We get complex and we get the simple. Na the simple one dey increase sugar. So people wey get diabetes, they dey chop carbohydrate, but na complex carbohydrate dem dey chop. Then they go balance and with protein wey suppose be 10 to 20% and fat wey suppose be 20 to 25%. So this one na for diet. Now the next thing wey we suppose try with this patient na exercise. No be serious exercise, no be say you go gym go dey carry weight up and down, because if you do too much exercise, you fit go reduce your blood sugar level so tey you go low pass normal. That one too na problem, wetin we dey call hypoglycemia. So na simple exercise people wey get diabetes suppose to dey do. Maybe dem fit dey walk, dem fit dey jog, dem fit dey do swimming. All these exercise wey we dey call aerobic exercise, e dey very good for all these diabetic patients. And if you be diabetic patient, you wan go do exercise, make sure say you chop food before you go do exercise. Make you no go reduce your blood sugar, and make you no go dey do exercise immediately after you don take medicine wey dey reduce blood sugar, because that one na double wahala you dey cause for yourself. Now if we don try diet, we don try exercise, and still this patient im blood sugar no dey reduce, we no dey fit control the blood sugar as we want, then we go come now introduce wetin we dey call oral hypoglycemic drug. This medicine na tablet wey these patients dey take. So this tablet then get the function to help you reduce your blood sugar to moderate level, or the level wey your doctor want make your blood sugar reach. Now if patient dey take this medicine, e still no dey reduce, we fit add another of these tablets. Okay, they get different type of tablets. So after the diet and exercise, we fit add one type of tablet. If e no work, we add another type of tablet with the exercise and the diet. And if that one no work, we fit come now put the insulin, wey be the same type of medicine wey dey reduce sugar, but na injection. Okay, now as we talk for our last video, we get to basically 2 types of diabetes, which will be type 1, type 2. The insulin na generally for type 1. Person wey get type 1 na insulin e dey take, whether you like am or not. Now if you get type 2 diabetes, you go dey take the tablet, but if the tablet no work, the fit come join insulin. Now you go take insulin if you be person wey get that type 2 diabetes wey no need insulin. We get certain situation wey fit cause make you need insulin. For example, if you dey pregnant, or if you dey breastfeed, you go need insulin. You go stop to dey take tablet, you go start to dey take insulin. Again, if you be person wey get that type 2 diabetes, and maybe you get some serious infection, or they wan do you surgery, you need to dey take that same insulin. And of course, if the tablet wey you dey take no dey function for you, then we go come add insulin for you. But generally insulin na for people wey get the type 1. That one forever insulin na they go dey take. So this one na the treatment wey we go do for person wey get diabetes. But this treatment too, e get in target. No be say we just wan do treatment anyhow. We get wetin we dey look for with this treatment. So your doctor go come dey measure all these things to know whether im suppose change your treatment, increase the dose, reduce the dose based on this target. One of the targets na wetin she don call glycated hemoglobin. At least you suppose get this glycated hemoglobin less than 7%. So as you dey do treatment, doctor go dey check that one like every 3 months if it's necessary, and then to make sure that it's less than 7%. And also your blood sugar, we wan make sure say if you dey fast, your blood sugar dey between 80 and 130. And if na the one wey dey take after food or after that glucose wey she talk, at least make e dey less than 180. And if you be person wey get cholesterol, high cholesterol for your blood, at least make e dey less than 100. And if you be hypertensive patient wey get diabetes on top, at least we want make your blood pressure dey less than 130/80. So these na the targets wey we dey look for person wey get diabetes.
The next thing we go talk about na complications. We get two main classifications of these complications. The first one na acute complications. That one na generally the ones wey go carry you go emergency room, right? The first one na hypoglycemia, where your blood sugar go drop drastically, where you suppose take something wey dey sweet sharp sharp, or if you no get access to something wey dey sweet, find yourself go emergency room quickly as possible. The second one na something wey we dey call ketoacidosis, and the third one na hyperosmolar diabetic coma. I know say these things na like big grammar, but generally those ones na hyperglycemia dey cause am, which means when your blood sugar increase more than normal to like levels wey dey too high, e fit cause these two last ones wey I don mention, and that one, yeah, na they suppose hospitalize yourself for that one. So these ones na the acute complications wey we get. The next one na chronic complications. In those ones, we get wetin we dey call microvascular complications. This one, e dey affect your eyes, wetin we go dey call retinopathy, diabetic retinopathy, where e go dey affect your eyes small, so you go dey lose your vision, dey go till you go blind patapata. The next one na wetin we dey call nephropathy. This one go affect your kidneys. And the next one na wetin we dey call neuropathy, where e go affect the nerves of your body. Now basically because of this, na you dey see say e get some diabetic patients wey dey develop this foot ulcer wey she don talk about. Now because of the nerves wey this diabetes dey affect, e dey degenerate your nerves, where they no go dey work the way they suppose work. You no go dey feel things wey you suppose feel. That way you go start to dey see say person leg don dey chop, e don dey rot ten somehow. E dey first start like pain, before you know am e go dey increase. Before you know am, e don start to dey form that ulcer. So na so the thing dey take form like that. Now because of this neuropathy wey diabetic patients dey fit develop this foot ulcer. The next complications na wetin we dey call macrovascular complications. That one dey mainly affect the heart, where person go get heart attack due to heart failure. Person fit get stroke, even paralyzed, or even fit die sef due to that stroke. The person fit even get wetin we dey call atherosclerosis, where this one dey affect the blood vessels for your body. And then lastly, the person fit come even develop chronic kidney disease. You go come need transplant or dialysis, etc. E get other complications where diabetic patients fit develop, like skin diseases, infections, and low immunity. People wey get diabetes, their immune system dey very low, wey dey make them vulnerable to infections. And then they fit even get other diseases due to nerve damage, like dementia, and so on and so forth.
Next wetin wey we go talk na prevention. We don talk prevention tire for all our videos, and generally na the same thing. If you wan prevent diabetes, you need to dey exercise, because we don talk say obesity na one of the big causes of diabetes. So you need to dey exercise so that your insulin fit dey function well. You also need to be eating healthy. Make you dey chop better food, na im be say you no go dey chop all this street food, you no go dey chop all this simple sugar. No be say you no go chop am once in a while, but make sure say wetin you dey chop na healthy things, fruits, vegetables, enough protein, enough, like, balance your food. Wetin dey teach us for school, balanced diet, na you need to dey chop. Alcohol too, you need to reduce your intake of alcohol. People wey dey take too much alcohol, dem dey get risk for diabetes. People wey dey smoke too get risk for diabetes. So all these things we need to dey control am. Another thing be routine checkup. You need to be person wey dey check himself every time. Na that way you go know whether you get one problem or the other. If you no dey check yourself, you no go know, because some disease dem silent, so you no go fit know. So especially if you be person wey get family members wey get diabetes, you suppose dey check yourself well, you suppose dey take care of yourself well. And also, if you be person wey get hypertension and other disease wey fit increase your risk of getting diabetes, you too, you suppose dey check yourself well, do routine checkup. If you be woman wey before, when you been dey pregnant, you been get high sugar level, you too, you need to dey check yourself continuously. If you be woman wey maybe you no get high level high sugar when you been pregnant, but the pikin wey you born weigh more than 4 kg, you need to dey check yourself continuously. So if you're a diabetic patient, or you're a person that is living with a diabetic patient, and you want to be able to control your blood sugar, you want to be able to measure your blood sugar levels at home, don't forget to tune in to watch our next video. Because in our next video, we're going to be teaching our viewers how to measure their blood sugar level at home without the need of going to a hospital. So please remember to tune in next week. We just want to say thank you for watching. Please remember to like the video, share the video, leave a comment or a question if you have one, and please don't forget to subscribe to our channel. And well, thank you for always watching, and we'll see you next week.
Bye.
Bye.